What are supplements and how do they work? So what would you say is the biggest misconception when it comes to supplements?
Shouldn't buy it. Like, I don't go
On
to the gas
Amazon.
station and buy insulin, right? I do not buy any supplements or creams from Amazon.
Do they have insulin at the gas station?
No,
Oh,
they don't.
okay. I
They
was
don't.
like,
But it's an example.
okay. I was like, whoa.
Oh.
All right, guys, welcome back to another episode of GLANZ Wellness with Dr. Linette Rivera. How are you, Dr. Rivera?
I'm doing great today.
You
How are
look
you?
so pretty today.
Thank you.
You're welcome.
I am not used to wearing a lot of makeup, so whenever they see me with makeup, I'm
I
like,
know.
wow.
For me, it's like, I think that's every girl's experience. It's like we're like taking a break and then all of a sudden we go back to it. It's like, wow, I look like this.
I know,
Yeah.
I know. And I want to record a video at home taking my makeup off. So I overdid it today.
All part of the strategy. But so today we have a very interesting topic all about supplements, how they work, misconceptions about them, etc. Dr. Rivera is an endocrinologist, so she knows all about, from hormones, supplements, etc. So, Dr. Rivera, I wanted to ask, just to start off everything with a general question, what are supplements and how do they work?
So when we talk about a supplement, right, it's a product that we are going to take, whether it is orally or by injection, to supplement, do exactly that, supplement something that we either are missing or we don't have enough of. So supplements come in many different forms. So we can talk about oral medications like tablets, powder, some are drops or liquid. If we talk about injectable supplements, some supplements are better injected, like B12, than orally, because when it comes to oral medications, they have to go through the entire GI tract. So sometimes what happens is they don't get really absorbed that well when they're done orally. But it's basically supplementing and taking something off that you are missing to be able to have wellness or for your body to work right.
So, are there certain health conditions that people need supplements for more than others? Can you give us some examples of that?
Yeah, so like I said, supplements are going to improve our overall health. But when it comes to why would we take a supplement? So some conditions you require supplements because whether you're not absorbing them well in the GI tract or you are just deficient for whatever particular reason. So for example, one very common example is patients that are vegetarian or vegan, right? They eat mostly fruits, vegetables, and things that are very low on proteins. So when we talk about, some, for example, vitamin B12, iron, magnesium, those are some supplements that they have to take because they're not getting it from the food that they're eating. An important thing that we have to think about is most of our supplements we get from either our food or the sunlight, right? Like vitamin D. Our water helps us with some supplements. The salt that we use in our food has now it has iodine, so that it helps with the thyroid. But some vegetarians or vegans they don't eat any of that. So what happens is they become deficient. You have to supplement it in a whole different way so that you can still have all the functions in the body work accordingly, because if not, then you're going to have thyroid problems, you're going to have problems with constipation and a whole set of other things that are not going to let you live your life the best way possible. If we talk about, for example, when we start getting older, right, we talk a lot about anti-aging. So when we're talking about what happens as we age, we lose collagen, we lose elastin, our skin gets dry. We can see how the skin can still look good, but it doesn't bounce back and forth like it used to when we are young.
A
right?
lot of the systems slow down, so it's
Correct.
just harder, right?
Right. So then if I pull on my patient's skin, if I do it on you, you're going to have a really good bounce back, right? Like a good elasticity of the
Mm-hmm.
skin because you're young. But when we see a patient that's 60 years old, they don't have that if they haven't been able to supplement. That's just normal aging. So we help that kind of like skin condition with oral collagen. So when we talk about collagen, it's always marine is better absorbed, but marine collagen has different types of collagen the same way our skin does. So there's type 2, type 4. So the way that we help the skin be able to still promote collagen as we age is by taking collagen every day. Another example is hypothyroidism, right? A lot of
You
people
get
have,
you get a ton of questions on that, specifically for the
yes,
weight loss program for the
right.
hypothyroidism.
So hypothyroidism is so popular. Patients come to me sometimes, I feel fatigued, I'm gaining weight, and they have no problems at all except that they're hypothyroid. They can go to the gym, they can try to lose weight, they can eat super healthy, and they're still not losing weight. And it can be due to hypothyroidism. So some of the supplements that actually help the thyroid make thyroid hormones are, for example, iodine, selenium. So it doesn't mean that we're going to take a ton of because we want our thyroid to get better.
Mm-hmm.
But if we have patients that are hypothyroid and they are on replacement medication, a multivitamin will be very good to help supplement that, or take magnesium because all those things work in the kind of like the pathway of making thyroid hormone.
Mm-hmm.
So I always recommend that if the patients with hypothyroidism have constipation, it's good to take magnesium at night to help them with accelerate their bowel movements. Patients that, for example, when we talk about anxiety, right? Anxiety, they're biting their nails. So, what can we do for that? So, one of the things, if you have problems with your nails or your hair, we recommend that you are not only on biotin, but for example, we have a supplement here in the office, which is made by Nutrafol, where before, I would say maybe 15 years ago, you would go to the pharmacy, get a bottle of biotin, take it, it will help with hair. Now we have seen how biotin is not only sufficient to be able to produce good hair and not only make new hair, but also maintain the one that you already have.
Mm-hmm.
So Nutrafol discovered this formula where they mixed a lot of different supplements, minerals, different roots, and different plants that can be used for hair. And they mix all of that into a simple capsule that you take every morning. They have a patented formula that helps with those three things that cause hair loss,
Yeah.
right? So losing our hair, maintaining the one that we have, and making new hair. So it helps with all of those things. But I think hair loss is very common as well because it happens not only with our hypothyroid patients, it happens as we age. It happens with patients that, for example, have a lot of like
Stress
stress.
and
Absolutely.
cortisol levels. Yeah.
And their cortisol levels, correct. So patients that are postpartum, right? When you're pregnant, all these things change and you can't take anything because you're pregnant.
Yeah.
So, for example, Nutrafol designed a postpartum formula that is specifically after you deliver, and it has high concentrations of some of those products to help with that hair loss. If we talk, for example, about cortisol, like you said,
Yes.
when we have a lot of anxiety or stress, or we are sick and we're going through different things in our bodies, right? Whether it is a cold or we are just, surrounded by stress, we have a sick family member, or at work, we have a big presentation, all those things increase our cortisol levels. What happens with that? When you increase your cortisol level, first, you get more hungry because it's a steroid. It's our steroid. Cortisol is in your body to react to a response of stress. But if you're really stressed out and you're not sick, which is something that the body can battle, then what happens is you're gonna be extremely hungry. You're gonna retain a lot of water. You could have palpitations. All these things happen, and you want to bring those cortisol. Your work is not going to change, right?
Yeah.
Stress doesn't change. If we are in a stressful job, we can't do anything about it. So for example, Nutrafol also has what's called stress adaptogen, which is different supplements, plants, and minerals linked together in a pill that you can take, and they all bring your cortisol levels down. And I'll tell you a little bit more about it. I'm going to read because this plant names are very difficult for me to
Yeah.
memorize. So, for example, one of the components is reishi mushrooms. That's in that stress adaptogen. That's made to decrease our cortisol levels, but it also calms our immune system from the reaction of stress, right? A lot of people, I don't know if you've heard people that say, I was stressed out and I completely developed a rash in my entire body. Why does this
Mm-hmm.
happen? It affects our immune system, so we are more prone to infections and getting sick. So supplementing that with a vitamin C, right? Whether it is a powder or a vitamin C tablet every day, we provide infusions here that have minerals, supplements, but
Mm-hmm.
high levels of vitamin C, glutathione, which is a very high antioxidant. All of those things help with immunity, calming down your body, and helping with stress. Another thing that this supplement has is Shisandra, which is a very powerful antioxidant. So, antioxidant, the same way vitamin C and glutathione help with calming our
Yeah.
bodies, releasing stress, bringing our cortisol levels down. It helps with pigmentation. It helps if your body feels like it's all under stress, your hair's not going to grow. You're going to, everything's going to be so swollen and filled with inflammation. The body doesn't function the way it's supposed to.
Mm-hmm.
And then the last one is one called rhodiola, which is helps not only with balancing stress, but it also helps with emotional and mental stress. So it also acts in the brain, right? So
Wow.
for example, I have patients that are like, my wife, it's like all stressed out. She barely eats. She cannot sleep, right? She has insomnia at night. So they start this supplement and it's like somebody turns down their on switch.
Yeah.
They kind of get a little bit more calmer. They can sleep better. They feel like they can have a conversation better. And this sounds all bogus, like,
Mm,
okay, you take a supplement and all these things happen,
yeah.
but they're true. This is the way our body works. And think about ancient years, right, when we didn't have any medications. If we think how people got treated, it was all plants, whatever was in the water and things that were from the earth to make us feel better because there was nothing else.
Yeah, there's nothing else. Yeah.
Nothing else. All those supplements have a mix of herbal supplements to help with all those things.
Mm-hmm.
And then, for example, I mentioned pregnancy. Pregnancy causes, not only stress, but also it can cause pigmentation, hair loss. Some patients retain water.
Yeah.
When you're pregnant, it's a little bit different because some of these supplements or herbal remedies, you can't take them while you're pregnant. Some of them can
And
induce delivery
we'll
and
we'll definitely do an episode all about that because there's so much
on
when on
pregnancy.
pregnancy and what
Yes,
you can't do. But yeah, I mean it's a lot. And yeah, it's hard to get the supplements you need when it's like, well, I'm not allowed to take them, so how else am I going to take them?
right.
So,
So I try to give them things that are okay with pregnancy. So, for example, they might not take a supplement for pigmentation, but we have topical solutions here that are safe in pregnancy. They prevent pigmentation, like melasma.
mhm.
And there are, I think, as the time goes by, we have created other alternatives for pregnant patients where they can still get facials, they can still get some aesthetic treatments
Mhm.
to prevent those pigmentations or those patches that the patients get, or even try to prevent losing our hair.
How long would you say it takes the supplements to show noticeable effect? Usually, everyone's different,
Hmm.
which and it's also about consistency too, because once you take a supplement one day, you're like, oh well, I'm getting amazing. No, you have to take them consistently,
Right.
right?
I think you have to give time. It's not something that you're going to feel right away, like taking blood pressure medicine and it brings your blood pressure down, or taking
Mm-hmm.
insulin. Supplements are going to be something that incorporates wellness. So you don't always instantly feel it, but it's doing their job. It's doing its job in the body.
Mm-hmm.
So I would say you have to at least give it 3 to 6 months. And like you said, the most important thing is consistency. I think, and I struggle with that myself as
Same.
well.
I have these little gummy ones, and
Yeah,
like I have them just up in my like kitchen shelf, and I always forget to take them, but it is so important to take them every single day.
absolutely. I think you have to create first a habit and then try to put them where either close to your keys or
Hmm.
by your toothbrush and things that can help you be consistent every day. Because if you are consistent, they definitely work.
Hmm. So, what would you say is the biggest misconception when it comes to supplements?
I would say first that you're gonna feel the effects right away. I think the other one would be that the patients are going to take it, and once they're better, they can stop. When we talk about supplements, it's the same as talking about some of the hormonal conditions.
Hmm.
Those are things that, unfortunately, because you don't have enough, you are not making enough of that, whether it is mineral, vitamin, or whatever it is in your body, you're not making enough of it, so you have to take this for life. I see that a lot, for example, in patients that take vitamin D, where their primary care physicians give them a high dose of vitamin D of 50,000 units a week. They do it for 8 weeks, and then they're like, okay, your levels are up, you can stop it.
And that's a prescription.
That's a prescription
Okay.
vitamin D medication. But I tell them you have to keep taking it because we don't get enough sunlight to be able to replete our levels of vitamin D. And even if we did, sunlight nowadays is horrible. You know, like the UVB and UVA rays and how it dehydrates your skin. I tell patients just take a vitamin D, it's so much better. And a lot of people now are using sunblock, which is great, but you can absorb the UV rays to be able to make vitamin D.
Mm.
But that's a big, huge misconception. Once you are feeling better, you have to continue and be consistent and not stop it. Another thing would be how we take those supplements, right? So some supplements are water soluble, so you have to take them on an empty stomach. Some supplements are fat soluble, so you have to take them with fatty foods. That improves your absorption. Like I said before, when we talk about oral supplements, I always recommend most of them to be IM or injected because they're absorbed better. But if you are going to take it at home, then you want to make sure, is this water soluble? Is it fat soluble? Do I have to take it on an empty stomach, or do I have to eat? Okay. So some water soluble vitamins would be like vitamin C, folate, if you're trying to get pregnant. If we talk about fat soluble vitamins, we can mention vitamin A, vitamin D, vitamin E, vitamin K. Um, I would say don't go to the pharmacy and just grab the whole aisle and start taking supplements randomly.
Guilty.
Do
I'm guilty of that.
please don't do that. So you want to make sure that this is recommended by a healthcare professional that can tell you, hey, based on this condition, I would recommend you take this. Magnesium can affect your heart. So it's just because they're vitamins and they're natural, it doesn't mean that they're
Mm.
100% safe and you could take tons of it.
And to show where you're inefficient, and you would have to take a blood test. That's the only way you would
Right.
know. Okay.
Yeah.
Okay.
So a blood test will tell you the levels. And for example, when we talk about iron, we can see not only your actual levels at the moment, but your storage of iron. So
Mm.
patients that have anemia, then we have to see, is it you're not making enough, you're not storage, you don't have enough storage, or is it your bone marrow that's the problem? So it's a little bit, it's not only, oh, supplements, let me go to GNC and just
Yeah,
start,
let's
let
just
me
get
get my pill
everything.
box.
I know.
So no, you want to make sure you talk to a healthcare professional first, especially if you're trying to get pregnant. Because, for example, folate is something that you should take even weeks or months before you want to get pregnant. You want to
Mhm.
have those high levels at the moment of conception, because when we talk about how the baby develops, it's the first week, right?
Yeah.
You want that storage of folate to be high. So that's something that you can ask your primary care, or you can always come here for a consult, and I'll be happy to tell you what you need.
I need a consult after this because all I do is
I need to see your shelf and see what you have.
I go to Costco and I just get like the pink bottle, like anything that's pink or like women's. I'm like, oh yeah, I
Oh
need
yeah,
this.
let me
But
take two.
no, can you give us some examples on where to find good quality supplements? Because don't be like me and be like, oh, it says for girls. Like just get the first bottle. If it's a pretty bottle, get the bottle.
Yeah.
You know, like yeah, give us your insight on that because that's a lot.
I think that's very important. That question is great.
Mm-hmm.
It's very important to know where we get our medications, our supplements, our
No,
vitamins. The same way that you don't go down the street and say, "Hey, can I have insulin at the
no,
garage?"
and now celebrities are coming out with their own supplements. Like Kourtney Kardashian has her own
Oh, I
supplement
didn't
line
know that.
too. Yeah, she has like a one for feminine health, one for like sleep, one for yeah. So
Interesting.
it's very cute, very Gen Z. It's very aesthetic.
Yeah, of
People
course.
love the design, but
Yeah.
it's just like yeah. I mean, now they're getting into that.
You have to check a few things. I don't know her product. It might be
Mm-hmm.
great. I
Yeah,
just think so. If it's from a company, you should buy it from that company. You shouldn't buy it like I don't go
on
to the gas
Amazon.
station and buy insulin, right? I do not buy any supplements or creams from Amazon.
Do they have insulin at the gas station?
No, they
Oh,
don't.
okay. I
They
was
don't.
like,
But it's an example.
okay. I was like, whoa.
Oh my god. No,
Yeah.
they don't sell that. That's
Never,
regulated.
never on Amazon. Never on
Never on
Amazon.
Amazon. I love Amazon for normal stuff, but things that you're gonna eat or you're
Put
gonna
on your
put on your
face.
face or you're gonna put on in your eyes, no, don't buy it from Amazon. And I'm gonna tell you why. One of the things is they can tamper the expiration date, right? So it's very important if you, for example, if you have an eye drop and you put an eye drop inside your eye and it's expired, you can get a massive infection. For example, or I'm saying it because of Opnique,
Yeah.
right? We sell a product
Hmm.
called Opnique, and some patients are like, "Do
We
they have it on Amazon?" I'm like, "No, don't."
we had a patient when I first started. She DM'd us and she was like, "Hey, do you guys sell Latisse for your eyelashes?" And we said yes. And she was really smart. She was like, "Okay, like, is it the real thing? Like, can you show me the box and
There you go.
everything?" Because she probably heard of really bad like experiences of
Mm-hmm.
people getting fake products, and on Amazon too. Like on TikTok, they'll talk about how you shouldn't buy on Amazon because the companies that are on Amazon, they might not even be the real companies. Like it's
Mm-hmm.
someone else pretending.
Right.
Like they set up the whole page and everything to look like it. It's like very
Right.
scary, but yeah.
And the companies cannot do anything about it because they're not going to be on Amazon all day trying to see who the
Like
scammers
fake, yeah,
are, right?
yeah.
And how can they prove without the product in front of them that it's a
Mm-hmm.
scam? So you have to make sure that first, like I said, let me start again.
Yeah.
So, like I said, me cago en nada, siempre digo so. Like I said, you have to make sure that you don't buy it there because they can tamper the expiration. The other thing is, if you buy something, Amazon works a lot with manufacturers that have kind of like a, ¿cómo se llama eso? Let me start again. But
Mm-hmm.
¿cómo se llama el warehouse? Warehouse. Yeah.
Warehouse.
You have to make sure. So buying from a non-reputable site where you don't even know where they're located, you don't know what this company is. Not only they can tamper the expiration date, but also which Amazon does this, they keep a lot of products in a warehouse which is closer to the state that you are ordering from, so
Mm-hmm.
that they can ship it, and that way they can do the prime,
Yes.
48-hour kind of like shipping. And what happens with some of these warehouses is that they don't have the correct temperature for the products. And then what happens is not giving that product the correct temperature that it needs means that it's going to get damaged. So whether it can cause an infection or it can
Or
give you
the
bad side
or the
effects,
formula might be altered because it's
or
supposed to
exactly,
stay in a certain temperature.
so it won't work.
Mm-hmm.
So you take something and then you say, "Oh, I took this doesn't work. It's a supplement, it's bogus." It's not that. Maybe the source where you got it from, it's not the best. So for example, here at the clinic, we sell all Nutrafol products. We buy them strictly from the company. We sell Omnique, which is it helps with opening our eyes. And then we sell all supplements, whether it is vitamin D or DIM or vitamin A. We sell them from Biote, and Biote really does good testing when it comes to their products to ensure that the doses are accurate, that the capsules are not filled with, junk or extra ingredients that you don't really need. And Biote has been a great source for our patients for actual vitamins.
Mm-hmm. So, with that being said, we gave you guys all the tools you need to kind of make the right decisions and, you know, understand a little bit better how to improve your anything that has to do with supplements. We have you right here. But what would you say, Dr. Rivera, is your piece of advice in terms of motivating our audience
So
today?
it has nothing to do with supplements.
Yeah,
So
yeah, yeah.
si quieres, you can say, what would you say is your piece of advice if someone wants to start supplements?
Uh-huh.
Let's do that.
Okay. So, what do you have a piece of advice to share with our viewers when they are starting supplements?
I would say get a consult with me. Here at the clinic, we're not only going to check your hormones and the supplements that you need, like vitamin
Mm-hmm.
B12, vitamin D, but also, like I said, based on your history, somebody has to sit down with you and talk, right? And say, what symptoms are you having? How are you feeling? Are you fatigued? Is it something else? We incorporate with our patients a lot of IV fluid therapy where if the patients are getting really sick, we put them on a regimen where they come in once a month or twice a month to get an immune bag, which has magnesium, calcium, and all these supplements that are going to not only help you feel better, but they are going to work. So the first step would be getting with your primary care or getting with somebody that knows about supplements. Another thing that can happen is you go to your primary care and they say, yeah, take a multivitamin and you should be
Yeah,
fine. That's not how it works. Multivitamins, sometimes they don't have enough
of what you need.
micrograms or milligrams of what you need. And it's based also on age. So, first thing is get a consult. And then second is, like you said, consistency. If you're going to start this journey, make sure that you're consistent, that you keep up with your doctor's appointment, and that you actually take everything in the morning or whenever you take it during the day.
Mm-hmm.
And
Well,
then, okay, now
yes.
um, just say, so, what do you write here? Oh, so do you have a motivation for the day? Because esta no se relaciona nada.
Do you have, okay, so do you have a motivation to share today?
Yes. So during the week, I was thinking of a quote or what motivational quote I could say, and nothing was sparking my excitement like the other few episodes where I'm like, okay, this is the quote of the day. I think I was thinking more of like sometimes we feel this is more of a personal journey, but I'm sure a lot of patients feel like that, where you are going through life and you are kind of not getting it right? Like you're trying certain things and they're not aligning, or whether it is frustration, or you're starting to get depressed, or you feel like it's like you try to pedal and it's the bicycle's not running. So I'm just gonna say, if you are feeling like that, or this is something that you're going through, just take it as a milestone for what's gonna happen. Always don't look at the bicycle not moving, but look at it as, what do I have to do and what do I have to improve to be able to get this running and for me to get to my endpoint. So always be positive. Don't let frustration or disappointment kind of get you depressed. Just reset your mind every morning and say, this is a new day. This is my start. Let me just keep going, because everyone goes through trials and tribulations, and God is always with you. So don't be disappointed and just be positive with yourself and with others around you.
And there's always going to be downs. Like,
Yes,
that's the way, like, you might reach a certain point where, oh, you're so good. And then you get very surprised of if there's a sudden turn of events or, oh, well, it's not what I expected. And you go a little down. But that's just a part of, like, the climb. That's a part of the journey. You're
of
never going to
course.
be always up and you're never going to be always down. So that's definitely um, a great piece of advice for
Yeah,
everyone starting
everybody.
their wellness journeys, starting their era of transformation. Just know that there are going to be good changes and bad changes, but to just don't give up on that. And yeah, this has been a great episode.
I loved it.
Yeah, super informative because now I'm like,
Sophia's going from here to the CVS.
I need, yeah, not even. I need to get my blood drawn right now. I probably have so many inefficiencies. So we're going to wrap this up. Thank you so much for your
Thank
time.
you, Sophia, for the
Thank you.
great questions.
Thank you so much for you guys watching. If you have any questions, comments, concerns, please comment down below or email us at our email linked in our bio. If you want to consult with Dr. Rivera, you can also reserve that on our website, also linked in our bio. And we will see you very soon.
Bye-bye.
Bye.